Hello and welcome. My name is Liz Peretz. My last job before I retired was to help integrate NHS and social care teams in Oxfordshire. I've campaigned for Oxford Keep Our NHS Public for many years, and I've been part of this campaign from the beginning. If it weren't for the fact that we're now in another lockdown, I'd be introducing you to a distant outdoor rally. I'm speaking instead from the old working class part of Oxford by the canal, called Jericho, far from the areas of high social deprivation in Oxford. We have some districts that have some of the highest deprivation rates in the country, near to the car factory in the east of the city, with very high rates of COVID. So to the campaign. It isn't really about Oxford, but it is about the importance of keeping things local. The UK still doesn't have an effective testing and tracing system. Getting this back in the hands of local communities under the leadership of public health teams could not be more vital. We need to find people quickly, and those who are self-isolating should be properly protected and supported financially, and with accommodation if they need it, and by their employers, and with local friendship and understanding. Doing this will create trust, encourage compliance, and simply be more effective. There needs to be national coordination, of course, national public coordination, NHS and local government coordination, but the balance of action should be in the hands of local public bodies. Vaccination's important and very welcome, but it'll be some time before sufficient numbers of us have been vaccinated. We still need a well-functioning testing and tracing system based in our communities. We need local walk-in facilities that people can get to, local speedy testing, local quick results. So we do need the resourcing, national resourcing, for the public health teams, for NHS labs, for GPs, for local environmental health teams, and even an ability to draw on local volunteers and voluntary agencies. The Labour-run Oxford City Council has led the way with the push for a better system by unanimously passing a cross-party motion on this subject.
Millions of individuals and families in the UK alone are suffering either directly from the health impacts of COVID or indirectly from the social, mental health and economic fallout of the disease. But it doesn't need to be like this. Evidence from other countries has shown that an effective test and trace system can significantly reduce the R number. Rather than infections rising, an efficient test and trace system can result in falling infection rates. Tragically, the UK government's largely privatised, centralised test and trace system is simply not working. Billions of pounds of public money have been handed over to private companies under inflexible contracts, and the local public health have been largely ignored. The current system is slow to test, slow to trace, and is simply not tracing sufficient numbers of people to keep the disease under control. This is why the Green Party supports the Crush COVID with Local Test and Trace campaign, and why I, as a Green Party councillor, recently helped draft and seconded a cross-party motion to Oxford City Council demanding change. It's not too late, even at this late stage, to revamp Test and Trace to follow a more decentralised model. This will not only save lives now, but make sure the same mistakes are not made in the future.
Hello, I'm Louise Upton, and I'm the Cabinet Member for Safer, Healthy Oxford here at Oxford City Council. When there was an outbreak of COVID-19 in the BMW factory here in Oxford last year, our environmental health team went in, identified the points where transmission was occurring, and put in protocols to stop it happening. This is what environmental health and public health workers do all the time. It's their bread and butter whenever there's an outbreak of disease or food poisoning. They find the people concerned and support them. So why didn't the government come to us as the pandemic took off last year? Why didn't they offer those contracts to local authorities who already have the expertise and could have trained up more staff? We could have integrated tracing infected people with offering them the support packages we have to enable them to self-isolate. And that includes the payments from government as well as help getting food and medicines to them. Instead, the government waited until it became clear that the private companies could not do it. Since October, the difficult cases have been passed to local authorities, who of course are doing brilliantly because we have the expertise. But we are in lockdown again. We are in lockdown because not enough people who tested positive for COVID were found, contacted and supported to stay at home. And that support to stay at home is absolutely crucial for the whole system to work. Oxford is incredibly proud of the multinational team based here that developed a vaccine so quickly. But until that is rolled out, we have to stop transmission of the virus. We have to find people who have it and help them to stay at home. We have to get a locally based, coordinated, nationally by the NHS, system of contact tracing and support to stop the spread. We need it for this pandemic and we will need it for the next one.
Hello, I'm Layla Moran. I'm the MP for Oxford West and Abingdon. I'm also the chair of the all-party parliamentary group on coronavirus. Test and trace and isolate, and in fact the whole thing, let's call it what it's meant to be, which is find, test, trace, isolate and support, was from the very beginning of this pandemic a critical part to keeping cases low. And this is a point that I and the Liberal Democrats have been making actually since this time last year. Because those countries that have managed to have a really highly functioning test, trace, isolate system are the ones who have done the best out of coronavirus, both in their economy, but also keeping cases incredibly low. But this is an area that I'm sorry to say, the government failed. It was very slow off the mark to get this going. It had a centralised system costing huge amounts of money. There's an NAO report recently that says that the envelope of money that they've allocated to test and trace is £22 billion. But they've missed the point, which is that unless you have isolate as part of that equation, to which they've only allocated 1.3 billion out of that 22 billion, then you aren't going to break the chains of transmission. And if you aren't going to do that, then what is the point? So yet again, over and over again, this government has got it wrong. And there are easy ways that this can be fixed. First of all, you need to pay people to isolate. If they'd spent just a fraction of that £22 billion on isolating, then they wouldn't be in the situation that they are now. And that's critical to our exit strategy. As we come out of this lockdown, the vaccine is no silver bullet. It's going to take months and months with hiccups along the way. It is the isolate part of test, trace, isolate that is going to keep those case numbers going lower. That is the key, by the way, to unlocking the economy. And this is the bit that the government seems to have not worked out. And the way that it's approached it has been utterly untransparent. I've been working with the Good Law Project to uncover some of the contracts that they have been awarding, and what we have seen from the department is a very defensive department who are being forced, kicking and screaming, to doing their statutory duty. The reason why transparency is so important is that without it, you can't improve. And I will underline by saying that all we ever wanted was for this to be the best it could possibly be. But there is a silver lining, which is that here in Oxfordshire, we have one of the best locally sourced test, trace, isolate systems that is anywhere in the country. In fact, we are country leading on this, and that's credit to our councils, and it's credit to the team working that we have here in Oxfordshire that that's happened, and that has complemented the national effort, the one very famously wasting so much money in Serco, but that we shouldn't diminish where it has gone well, and it's unsurprising to me anyway that in Oxfordshire we are getting it right.
I'm Anneliese Dodds, the Labour MP for Oxford East. I'm speaking today in support of the campaign to make sure that we have local public services delivering test, trace and isolate. We've known for many months now that when those services are delivered locally through public health workers and other public organisations, they've been far more effective. We've seen that, for example, in Labour-run Wales, where they've had a local public approach from the beginning and where they've consistently contacted far more people than through the London Conservative government's centralised, privatised approach. We really need to see local areas given that control and the resources necessary so that they can ensure people get the help they need and so that they're alerted to when they may have come in contact with a COVID positive person. And of course, we also need reform to the support for those who need to self-isolate. We've known again for so many months that the current system is not working. The current Secretary of State for Health admitted himself that he couldn't live on statutory sick pay. And the introduction of a £500 payment has not solved this problem. Government hasn't indicated clearly enough who should be eligible for that payment. They haven't made sure that local authorities were properly funded to deliver it. And overall, that's been a terrible false economy. We know the impact for individuals on having COVID spread more, even more, in our workplaces and our communities. It's a terrible economic cost, and it's one that government needs to focus on, and they really need to get a grip on this issue of support for self-isolation. So my support to those who are pushing on this, trade unionists, those who are also within campaigning organisations. Let's get that change. Let's make sure that we can defeat COVID.
We hope that other areas in the country will set up similar campaigns. Some we know already have. Together we can get the government to change its minds. Thank you.